Hi, and welcome back to Senior Balance Hub. If you've been feeling a little wobbly or dizzy lately, this video might be the most important one you watch all year. Did you know that thousands of seniors fall every year because of their medications? It's true. It's a quiet problem that a lot of people don't talk about, and it's a huge reason why we created our last video, The Hidden Balance Killers in Your Medicine Cabinet. That video was a real eye-opener for many of you. We got hundreds of comments from viewers saying things like, "I had no idea my blood pressure pills could make me dizzy, and now I understand why I feel so unsteady in the mornings." You learned that common medications, pills you might have been taking for years, can slowly and sneakily mess with your balance. But knowing you have a problem is only half the battle. Now, it's time to fight back. Today, we are going to dive into the practical stuff. We are talking about 5 simple habits that you need to avoid. 5 little mistakes that could be making you dizzy and putting you at risk of a fall. These aren't big, complicated things. They're small everyday habits that millions of seniors do without thinking twice. Think of it like this. Your medications are a team working to keep you healthy. Your blood pressure pill is keeping your heart safe. Your diabetes medication is keeping your blood sugar stable. Your pain medication is helping you move around comfortably. But sometimes, this team gets a little confused. They might make you feel unsteady, like you're walking on a boat that's gently rocking back and forth. The habits we are going to talk about today are like pouring water on that boat. They make the problem worse, not better. They take a small balance issue and turn it into a big safety concern. But don't worry. The good news is that these habits are easy to change. Once you know what to look for, you can start making yourself safer right away. You don't need expensive equipment or complicated routines. You just need to be aware of what you're doing and make some simple adjustments. I want to be clear about something before we start. This isn't about being afraid of your medications. Your pills are helping you stay healthy and active. This is about being smart with them. It's about understanding how they work so you can take them safely. Let's get started with the first habit that could be putting you at risk. We've all done it. You're sitting in your favorite armchair, reading the newspaper or watching your favorite TV show. You decide you need a snack from the kitchen, or maybe you hear the phone ringing. Without thinking, you spring up like a jack-in-the-box. What happens next? A head rush. The room spins for a second. You might feel like you're going to faint. You grab onto the nearest piece of furniture for dear life. Sound familiar? This happens to almost everyone once in a while. But for seniors taking certain medications, it can happen a lot more often. And each time it happens, you're at risk of falling. This isn't just a normal sign of getting older. It's often a side effect of common medications that millions of seniors take every day. Blood pressure pills, water pills, also called diuretics, and even some antidepressants can cause your blood pressure to drop when you stand up quickly. Doctors have a fancy name for this, orthostatic hypertension. But let's just call it the standing up too fast folly. Let me explain what's happening in your body. It's like your body's plumbing system. When you're sitting or lying down, all the blood is just hanging out, doing its thing. Your heart is pumping steadily, and everything is balanced. But when you stand up suddenly, gravity becomes your enemy. It pulls all that blood down toward your feet. In a healthy body with no medications involved, your system has a backup plan. Special sensors in your body notice that your blood pressure is dropping. They quickly tell your heart to beat faster and your blood vessels to tighten up. This sends blood rushing back to your brain in just a few seconds. But here's the problem. Certain medications interfere with this backup system. Blood pressure pills are designed to keep your blood pressure lower, which is good for your heart. But sometimes they work a little too well when you stand up fast. Water pills make you lose fluid, so there's less blood volume to work with. Some antidepressants can slow down those sensors that are supposed to fix the problem. So for a few seconds, your brain is like, "Hey, where'd all the blood go?" And that's when you feel dizzy, lightheaded, or like you might pass out. Here's what makes this really dangerous. Those few seconds of dizziness are when most falls happen. You're already off balance from standing up, and then you get hit with a wave of dizziness. Your reflexes aren't as quick as they used to be, so you can't catch yourself in time. So what is the fix? Don't spring up. Think of yourself like a cat waking up from a nap. Cats don't jump up and immediately start running around. They stretch, they look around, they take their time. You should do the same thing. Here's exactly what to do. When you want to get up from sitting or lying down, don't rush. First, Sit on the edge of your chair or bed for about 10 to 15 seconds. Just sit there and let your body adjust. Do you feel dizzy or lightheaded? If you do, wait another 10 seconds. There's no hurry. While you're sitting there, you can do a little test. Move your head gently from side to side. If that makes you feel dizzy, you definitely need to wait a bit longer before standing. When you do stand up, do it slowly and deliberately. Hold on to something sturdy if you can, the arm of your chair, a table, or a wall. Take 1 or 2 slow steps before you start walking normally. This might seem like a lot of work at first, but it quickly becomes a habit. And it could literally save your life. I've heard from so many viewers who said this one simple change stopped their dizzy spells completely. If you're still getting dizzy even when you stand up slowly, that's important information for your doctor. It might mean your medication dose needs to be adjusted, or the timing of when you take it might need to change. Let's talk about the next habit. Here's a scenario that happens every day. You wake up with a stuffy nose and a headache. Maybe you're getting a cold, or your allergies are acting up. You think, no big deal, I'll just grab some cold medicine from the drugstore. You walk down to the pharmacy section, grab a bottle of cold and flu medicine, maybe pick up some extra strength pain reliever, and take them without a second thought. This is a huge mistake, and it's one of the most dangerous habits that seniors can have. Here's the problem. Just because a medication doesn't require a doctor's prescription doesn't mean it's harmless. Over-the-counter medications can be very powerful. And when you mix them with your prescription medications, it's like throwing 2 different kinds of chemicals into a pot and hoping they play nice together. You never know what's going to happen. Let me give you some examples of how this can go wrong. Many over-the-counter cold and flu medicines contain ingredients that can make you drowsy and unsteady on your feet. One common ingredient is diphenhydramine. You might know it as Benadryl. This drug is in a lot of sleep aids and allergy medicines. It can make you feel foggy and wobbly for many hours after you take it, especially if you're over 65. Now, let's say you're already taking a prescription medication that makes you a little dizzy, maybe a blood pressure pill or an anxiety medication. When you add the over-the-counter medicine on top of that, the effects don't just add up. They can multiply. You might go from feeling slightly unsteady to feeling like you can't walk straight. Sleep aids are another big problem. A lot of seniors buy over-the-counter sleep aids when they're having trouble sleeping. These often contain the same diphenhydramine I mentioned earlier. The problem is that this drug stays in your system for a long time, especially as you get older. Your liver doesn't process drugs as quickly as it used to. So you take a sleep aid at 10 p.m., thinking it will help you sleep better. You wake up at 7 a.m. feeling refreshed. But that sleep aid might still be affecting your balance and thinking until noon or later. You think you're wide awake and ready to go, but your body and brain are still feeling the effects. Pain relievers can be tricky too. Ibuprofen, naproxen, and other anti-inflammatory drugs can interact with blood pressure medications and blood thinners. They can also cause stomach problems that might make you feel weak or dizzy. Even vitamins and supplements can cause problems. I know that sounds crazy, but it's true. Too much vitamin D can make you feel confused and weak. Some herbal supplements can make blood pressure medications work too well, causing dangerous drops in blood pressure. What is the solution to this habit? Stop mixing pills without a pharmacist's help. Before you buy any over-the-counter medicine, talk to your pharmacist. Not the cashier, the actual pharmacist. They went to school for years to learn about drug interactions. They know which combinations are safe and which ones are dangerous. Here's exactly what to do. Bring a list of every single medication you take. Include prescriptions, vitamins, supplements, and even herbal teas if you drink them regularly. Tell the pharmacist what symptoms you want to treat. They can recommend something that won't interact with your other medications. If you're already taking over-the-counter medications regularly, it's time for a review. Make a list of everything you take from the drugstore: pain relievers, sleep aids, allergy medicines, vitamins, everything. Take this list to your doctor or pharmacist and ask if all these things are safe to take together. Don't be embarrassed about how many things you're taking. The pharmacist isn't going to judge you. They want to help you stay safe. A quick 5-minute conversation can save you from a dangerous interaction. One more tip: try to buy all your medications and supplements from the same pharmacy if possible. That way, the pharmacist can keep track of everything you're taking and watch out for problems. Let's talk about something that seems simple but can cause big problems: when and how you take your medications. Picture this. You wake up in the morning, and the first thing you do is take your pills. You grab them off the nightstand with a sip of water and get on with your day. No breakfast, no snack, nothing. Or maybe you're rushing out the door and you remember to take your afternoon medication, but you haven't eaten anything since breakfast. This is what I call the taking pills on an empty stomach trap, and it can make you feel dizzy and unsteady in ways you might not expect. Here's why this matters. Your stomach is like a mixing bowl. When you eat food, it creates a nice, gentle environment for your medications to dissolve in. The food slows down how fast the medication gets absorbed into your bloodstream. This means you get a steady, even dose of the medicine over time. But when you take pills on an empty stomach, it's like dumping the medication directly into your bloodstream all at once. You get a big spike of the drug, followed by a drop. This roller coaster effect can cause sudden dizziness, especially with certain types of medications. Blood pressure medications are a perfect example. When you take them with food, they work slowly and steadily to keep your blood pressure at the right level. But when you take them on an empty stomach, they might work too fast and too hard. Your blood pressure could drop suddenly, making you feel dizzy or weak. Diabetes medications can be even more dangerous when taken without food. These drugs are designed to work with the food you eat. If you take them but don't eat, your blood sugar can drop too low. Low blood sugar can make you feel shaky, confused, sweaty, and very unsteady on your feet. Some pain medications can cause stomach upset when taken without food. This might not seem related to balance, but think about it. If your stomach hurts, you might hunch over or move differently. You might not be paying attention to where you're walking. Stomach pain can also make you feel weak and dizzy. Even some vitamins work better with food. Iron supplements, for example, are much easier on your stomach when taken with a meal. Calcium is absorbed better when you take it with food. But here's where it gets confusing. Some medications actually work better on an empty stomach. Thyroid medications, for example, should be taken first thing in the morning with just water, at least 30 minutes before eating. Some antibiotics work better without food. This is why it's so important to read the instructions on your pill bottles and follow them exactly. What must you do next to fix this? Read the label and eat something when needed. This fix is simple, but you have to be consistent about it. Every medication bottle has instructions about how to take the medicine. Look for phrases like take with food, take on an empty stomach, or take with a full glass of water. If the bottle says take with food, that doesn't mean you have to eat a full meal. A piece of toast, a handful of crackers, a banana, or even a glass of milk is often enough. The goal is to have something in your stomach to cushion the medication. If you're not sure what counts as food, ask your pharmacist. They can tell you exactly what you need to eat and how long before or after taking the medication. Here's a practical tip. If you take multiple medications at different times of the day, make a chart. Write down what time you take each pill and whether it needs food or not. Keep this chart in your kitchen or wherever you keep your medications. If you take medications first thing in the morning but don't usually eat breakfast, consider changing your routine. Keep some crackers or a banana by your bedside. Eat them before you take your morning pills. For medications that you take multiple times a day, try to time them with your meals when possible. Take your morning pills with breakfast, afternoon pills with lunch, and evening pills with dinner. If you're supposed to take a medication on an empty stomach, make sure you understand what that means. Usually, it means taking the pill at least 1 hour before eating or 2 hours after eating. Don't skip meals just because you forgot to take a medication that needs food. It's better to take the medication a little late with food than to take it on time with an empty stomach if the label says it needs food. This next habit might be the most dangerous one we talk about today, and it's something that happens more often than you might think. Here's the scenario. You're in pain. Maybe your back is aching something fierce, or your arthritis is flaring up, and your knees feel like they're on fire. You took your pain medication like you're supposed to, but 2 hours later, you still hurt. The directions on the bottle say to take 1 pill every 4 to 6 hours, but you think, I'm still in pain. I'll just take 1 more. It'll work faster and better. Or maybe you're having trouble sleeping. You took your usual sleep medication an hour ago, but you're still wide awake. You think, 1 more pill won't hurt. I really need to sleep. This is what I call the just 1 more dose danger. And it's one of the riskiest habits you can have, especially when it comes to your balance and fall risk. Here's why this is so dangerous. Medications are not like food or vitamins where a little extra might not hurt. Medications are powerful chemicals that are carefully calculated to give you the maximum benefit with the minimum risk. When doctors prescribe a medication, they consider your weight, your age, your other health conditions, and what other medications you're taking. The dose they prescribe is designed to work safely in your body. When you take more medication than prescribed, you're not just doubling the good effects. You're also doubling, or sometimes tripling, the side effects. And for many medications that seniors take, the main side effects are dizziness, confusion, and loss of coordination. This is especially true for strong pain medications like oxycodone, morphine, or other opioids. These drugs don't just stop pain, they also slow down your nervous system. When you take the prescribed dose, they might make you slightly drowsy or a little less sharp than usual. But when you take extra, they can make you feel like you're walking through thick mud. Your reflexes slow way down. Your thinking gets foggy. You can't catch yourself if you start to fall. Muscle relaxants are another type of medication where just one more can be extremely dangerous. These drugs are designed to make your muscles less tense, which can help with back pain or muscle spasms. But they also make all your muscles less coordinated. Taking extra can make you so unsteady that even walking across the room becomes dangerous. Sleep medications are particularly risky for dose creeping. That's when people gradually take more and more over time. Your body gets used to the medication, so the normal dose doesn't seem to work as well. You think you need more to get the same effect, but sleep medications can stay in your system much longer than you realize, especially as you get older. Taking extra can make you groggy and unsteady the next day, even if you feel wide awake. But here's what really scares me about this habit. It often starts small and gets worse over time. Maybe you take an extra half pill once when the pain is really bad. It seems to help, so you do it again next week. Pretty soon, you're regularly taking more than prescribed. This is called dose escalation, and it can lead to serious problems. Taking more medication than prescribed can also lead to dangerous interactions with your other medications. Your doctor prescribed your other pills assuming you're taking the pain medication at the prescribed dose. When you take extra, it can change how your other medications work. This fix is simple to understand but can be hard to follow when you're in pain or having trouble sleeping. But it's absolutely crucial for your safety. Here's your new rule. Never, ever take more medication than what's written on the bottle. Not even half a pill more. Not even if you're in terrible pain. Not even if you haven't slept in 2 days. The dose on the bottle is the maximum safe amount for you. If your medication isn't working well enough, that's not a reason to take more. It's a reason to call your doctor. Write down exactly what's happening, how much pain you're in, what time of day it's worst, how long the medication seems to work, and any side effects you're having. This information will help your doctor figure out what to do next. Your doctor has lots of options besides increasing your dose. They might switch you to a different medication that works better for you. They might add a second medication that works in a different way. They might change the timing of when you take your current medication. Or they might refer you to a specialist who can help with non-medication treatments. Here are some practical strategies to help you stick to the prescribed dose. First, use a pill organizer. Those little boxes with compartments for each day of the week can be lifesavers. Fill them up once a week with exactly the right number of pills for each day. When the compartment is empty, you're done for the day. Second, set alarms on your phone or watch to remind you when to take your next dose. This helps prevent you from taking medication too early because you forgot when you took the last dose. Third, keep a medication diary. Write down what you took and when you took it. This helps you keep track and also gives your doctor valuable information about how well your medications are working. Fourth, if you're tempted to take extra medication because of pain, try other pain management techniques first. Use ice or heat, gentle stretching, meditation, or distraction techniques. Sometimes these can help enough to get you through until it's time for your next scheduled dose. If you're taking extra sleep medication because you can't sleep, try other sleep strategies first. Make sure your bedroom is dark and cool. Avoid caffeine and big meals before bedtime. Try relaxation techniques or gentle stretches. If you still can't sleep after trying these things, talk to your doctor instead of taking extra pills. Remember, your doctor prescribed that specific dose for a reason. Trust their expertise, and speak up if the medication isn't working well enough. There are always other options that are safer than taking extra medication. This last habit might be the most important one we talk about today, because it affects everything else we've discussed. Picture this. You started taking a new medication a few days ago. Maybe your doctor increased the dose of something you've been taking, or you started a new pill for your blood pressure or your diabetes. You've been taking it just like the doctor said, but you notice something. You feel a little different. Maybe you're more tired than usual. Maybe you feel slightly dizzy when you walk to the mailbox. Maybe you find yourself holding onto the wall as you walk down the hallway to the bathroom. There's a little voice in your head that says, that's weird. I don't usually feel like this. But then another voice jumps in and says, oh, it's probably nothing. I'm just getting older. I'll get used to it. So you ignore that first voice and go on with your day. This is what I call the ignoring the little voice habit. And it might be the most dangerous habit of all, because that little voice is your body's early warning system. Your body is incredibly smart. It knows how you usually feel when you walk across the room. It knows how alert you usually are when you wake up in the morning. It knows how steady you usually feel when you're standing in the shower. When something changes, your body notices right away and tries to tell you about it. But here's what happens. We've been taught to tough it out and not complain. We think that feeling a little off balance or tired is just part of getting older. We don't want to bother our doctors with little things. So we ignore those early warning signs. This is a huge mistake. Many serious balance problems don't start with a dramatic fall or a major dizzy spell. They start small. You feel slightly more tired after taking your morning pills. You notice you're holding onto furniture more when you walk around the house. You feel a little foggy or confused at certain times of the day. These small signs are like the check engine light in your car. They're telling you that something needs attention before it becomes a big problem. If you ignore them, that small balance issue can slowly get worse until you're at serious risk of falling. Here's what makes this especially tricky. Medication side effects often develop gradually. You don't suddenly wake up one morning feeling terribly dizzy. Instead, you might notice that you feel slightly less steady than you used to. Over weeks or months, this gradually gets worse, but because it happens slowly, you might not realize how bad it's gotten. I hear this from viewers all the time. They'll say something like, I didn't realize how unsteady I'd become until I fell and broke my wrist. Looking back, I can see that I'd been feeling off balance for months, but I just thought it was normal aging. Another problem is that we sometimes blame the wrong thing. You feel dizzy and think, I must not have had enough coffee this morning, or I probably need to eat something. You don't think about the new medication you started last week. But often, the medication is exactly the problem. Sometimes we ignore symptoms because we don't want to admit that a medication that's supposed to help us is actually causing problems. We think, my doctor prescribed this for my heart. It's keeping me healthy. I can't complain about side effects. But your doctor needs to know about side effects to help you properly. Here's what to do. Your body is trying to communicate with you. That little voice that says something feels different is giving you important information. Don't ignore it. Here's exactly what you should do when you notice changes in how you feel. First, pay attention to timing. When do you feel dizzy or unsteady? Is it always around the same time of day? Is it within a few hours of taking certain medications? This timing. Information is incredibly valuable for figuring out what's causing the problem. Second, start keeping a simple diary. You don't need anything fancy, just a small notebook or even the back of an envelope. Write down what medications you take and when you take them. Also write down when you feel dizzy, tired, confused, or unsteady. After a week or two, you might start to see patterns. For example, you might notice that you always feel dizzy about an hour after taking your morning blood pressure medication. Or you might see that you feel especially unsteady on the days when you take an over-the-counter pain reliever along with your regular medications. Third, don't minimize your symptoms when you talk to your doctor. Don't say, it's probably nothing, but. Instead, say, I've noticed that I feel dizzy every morning around 10 a.m., and I'm concerned it might be related to my medications. Be specific about what you're experiencing and when it happens. Fourth, bring your medication diary to your doctor appointments. This shows your doctor that you're paying attention to your health and gives them concrete information to work with. Fifth, don't wait for your next scheduled appointment if you're having new symptoms that affect your balance or make you feel unsafe. Call your doctor's office and explain what's happening. Many balance-related medication problems can be fixed quickly with a simple adjustment to your dose or the timing of when you take your pills. Remember, you are the expert on your own body. You know better than anyone else how you usually feel and when something is different. Your doctors are experts on medications and diseases, but they need your input to help you effectively. You have a right to feel safe and steady on your feet. You're not being a complainer or a hypochondriac when you report symptoms that worry you. You're being a smart patient who is taking charge of your health. Now that we've talked about all 5 habits, I want to explain why they're especially dangerous when they happen together. It's not just that each habit can cause problems on its own, it's that they can multiply each other's effects. For example, let's say you're guilty of habit number 1, standing up too fast, and habit number 2, mixing over-the-counter medications with your prescriptions. You take your regular blood pressure medication, plus some over-the-counter allergy medicine that makes you drowsy. Then you stand up quickly from your chair. The blood pressure medication makes your blood pressure drop when you stand up. The allergy medicine makes your reflexes slower. Standing up fast doesn't give your body time to adjust. The result? You're much more likely to feel dizzy and fall than you would be with just one of these factors alone. Or maybe you're doing habit number 3, taking pills on an empty stomach, and habit number 4, taking extra doses. You take your diabetes medication without eating breakfast, which makes your blood sugar drop. Then, because you feel weak and shaky from the low blood sugar, you think you need extra pain medication. The extra pain medication makes you more confused and unsteady. Now you have low blood sugar and medication side effects working together to make you much more likely to fall. This is why it's so important to look at all of your medication habits together, not just one at a time. Now that you know about these 5 dangerous habits, it's time to make a plan to change them. Don't try to fix everything at once. That's too overwhelming. Instead, pick one habit to focus on first. Week 1. Focus on standing up slowly. This is often the easiest habit to change and can make the biggest immediate difference. For 1 full week, practice standing up slowly every single time. Sit on the edge of chairs and beds for 10 seconds before standing. Notice how this makes you feel. Week 2. Review your over-the-counter medications. Make a list of everything you take that you bought at the drugstore: pain relievers, sleep aids, allergy medicines, vitamins, everything. Take this list to your pharmacist and ask if any of these could interact with your prescription medications. Week 3. Check your medication timing. Look at the instructions on all your pill bottles. Make sure you're taking each medication at the right time and with or without food as directed. Create a simple chart if it helps you remember. Week 4. Count your pills. Make sure you're taking exactly the prescribed amount of each medication. No more, no less. If any medication isn't working well enough, make a list of specific problems to discuss with your doctor. Week 5. Start listening to your body. Begin keeping a simple diary of how you feel each day, especially noting any dizziness, confusion, or unsteadiness. Pay attention to patterns and timing. So when should you call your doctor? You should call your doctor or pharmacist right away if you experience any of these symptoms. Sudden, severe dizziness that doesn't go away. Feeling like you might faint. Confusion or feeling foggy that's new or getting worse. Any fall, even if you don't get hurt. Feeling unsteady on your feet most of the time. Dizziness that happens at the same time every day. Any new symptom that started after beginning a new medication. Don't wait for these symptoms to get better on their own. Balance problems related to medications usually get worse over time if they're not addressed. When you talk to your doctor or pharmacist about balance and medication issues, here are some important questions to ask. Could any of my medications be causing dizziness or balance problems? Are there any interactions between my prescription medications and the over-the-counter medicines I take? Should I take any of my medications at a different time of day to reduce side effects? Are there alternative medications that might cause fewer balance problems? What symptoms should I watch for that might indicate a medication problem? How long should I expect to feel side effects when starting a new medication? Remember, no question is too small or too silly. Your healthcare team wants you to be safe and feel good. Here's what I want you to remember from today's video. Small habits can make a big difference in your safety and your quality of life. These 5 habits we've talked about are common, but they're not harmless. Each one can increase your risk of dizziness, confusion, and falls. But here's the good news. Every single one of these habits can be changed. You don't need special equipment or expensive treatments. You just need to be aware of what you're doing and make some simple adjustments. Start with one habit. Focus on it for a week. Once that feels natural, move on to the next one. In just a few weeks, you can significantly reduce your risk of medication-related balance problems. Remember, you are in charge of your health. Your doctors and pharmacists are your partners in keeping you healthy and safe, but you're the one who has to speak up when something doesn't feel right. Your medications are tools to help you live a healthy, active life. By taking them smartly and safely, you can get all the benefits while minimizing the risks. In our next video, we are going to talk about how to have a productive conversation with your doctor about medication and balance concerns. We'll give you a complete script for what to say and what questions to ask to get the help you need. We are also working on a video about simple exercises you can do to improve your balance, even if you have to deal with medication side effects. These exercises can help you feel more confident and steady on your feet. If you found this video helpful, please give it a thumbs up and subscribe to Senior Balance Hub. Ring that notification bell so you don't miss our new videos about staying steady and safe. Do you have questions about specific medications and balance? Leave them in the comments below. While I can't give personal medical advice, I read every comment and use your questions to plan future videos. And remember, you're not alone in dealing with these challenges. Millions of seniors take medications and face similar balance concerns. The key is being informed, being proactive, and working with your healthcare team to find solutions. Thank you for watching, and thank you for taking charge of your health. Stay steady, stay safe, and remember, you've got this. I'll see you in the next video, where we'll continue helping you live your best, safest life. Until then, take your time, listen to your body, and don't be afraid to speak up when something doesn't feel right. Your safety and your health are worth it. You are worth it.